So one of the great things about being at BTOG this year is that it really feels like we're beginning to put COVID behind us, and we've got everyone here in person, and everyone is busy at home treating patients, and in the case of many of us, working on trials to develop the treatments of tomorrow. And that during COVID, of course, was not a given, and a lot of cancer patients' treatment was interrupted and compromised, and certainly the progress of a lot of trials was compromised. During that uncomfortable era, we came up with quite a lot of ways of working around the problems and the dangers of COVID and the prevalence of the disease in the community. And many of us feel that that's taught us ways of conducting trials that actually might be safer, more efficient, more patient-friendly, cheaper even than in the past. My group at Guy's have recently published an opinion piece in the British Journal of Cancer outlining these thoughts, and I think that was quite widely received, published with a sort of positive editorial from the journal. And I think in the community there's a feeling that yes, we probably need to fight back against some of the conservatism and the we've always done it that way kind of approaches to deliver studies as seamlessly as possible. And from the patient's perspective, of course, in oncology we're working with patients who've got often significant symptom burden and perhaps are life limited, particularly in my area of early phase trials. And we need to make trials more accessible to patients, and so that they can contribute in the way that so many of them want to, but without so much of a cost to them, and certainly without some of the risks of being on studies that we had to put up with during COVID.